All right. Good afternoon, everybody. Welcome back to City Hall, for those of you who haven't been here in a while. We appreciate you being here. Our community has received an eye-opening reminder that the COVID-19 pandemic is far from over. The region's positivity rate doubled last week, as was reported, jumping to 11.2% from 5.4% the week prior. The last time we were at 11% was in January, when 6,000 people tested positive in a week. We've seen a significant decline in testing. Last week, 8,673 were tested and 971 people were positive. So again, that's context compared with the last time we were at 11%. And as you remember, we were testing upwards of 60,000 people per week at the height of the pandemic. Our 7-day rolling average of cases, which is how we've gauged the progress of this infection and our ability to contain it, is now 126. With a highly transmittable Delta variant driving the renewed momentum of the virus, the coronavirus has begun accelerating its troubling spread throughout our region and throughout the state. The increase in COVID-19 cases is a reminder that after 230,623 known COVID patients and 3,578 deaths in our community, the virus isn't finished with us. And just as a brief aside, every day that Judge and I were on the air, we've asked folks to keep those who have lost loved ones in your prayers, and we continue to do that because this virus, again, has taken too many of our loved ones and neighbors. Fortunately, there is a big difference between now and back in January. Back then, we were just starting to distribute vaccines. Now, more than 1 million people have been fully vaccinated in Bexar County. That's 62% of our residents. Some 1.2 million, or 74%, have received at least one dose. Vaccinations are the essential factor that has put us in better shape than we were a year ago. And because of vaccinations, COVID-19 cases are milder and our hospitalization rate is much lower. An average of 155 COVID patients were in the hospital last week. 6 months ago today, there were 1,411 COVID patients that were hospitalized in our community. But as we have emphasized over and over again, it is far too soon to relax and let our guard down. The renewed growth in new cases and hospitalizations is concerning, particularly for those who are unvaccinated. COVID-19 remains deadly, and the unvaccinated remain at risk of hospitalization or severe illness. Earlier this year, we were vaccinating 2,500 people a day at the Alamo Dome, and then again, additional thousands of folks at Wonderland and many of the other private providers around town. That's compared to less than 200 now at the Alamo Dome. Ironically, while the vaccination rates have slowed, vaccines are easily available at public sites as well as pharmacies and doctors' offices. As a reminder, it doesn't require an appointment, it doesn't require health insurance. You can walk up and go get your vaccine. And a reminder, the vaccine again is free at city sites. You don't need to have insurance to get vaccinated. You will not be asked your immigration status. The bottom line is vaccines save lives and thwart the spread of the virus. Don't take unnecessary chances. Get vaccinated and protect yourself. A double jab beats an extended rehab. We also want to remind businesses with fewer than 500 employees that if you allow your employees to take paid time off for a COVID-19 vaccine, you could be eligible for a tax credit through the American Rescue Plan of 2021. And you can learn more about that by visiting the IRS website under Employer Tax Credits. Now let me turn it over to our partner in fighting this virus, Judge Wolf.
Well, thank you, Mayor. And the Mayor gave you out some very clear statistics of what's happening to us. And we didn't know what to expect as we hit the very low that we were at. In fact, on June the 15th, we were down to only 117 people in the hospital. And now As of just yesterday, we're up to 258 people in the hospital. That's a huge double, almost doubling numbers in less than a month, and they're continuing to climb. What we see happening is that young people are the ones that are choosing, by and large, not to get vaccinated. In the age group of, say, 15 to 19, only 29% have been fully vaccinated, 29%. Gets a little better as you get to the little 20 to 24 is 33. Get to 20 to 29 is 33. Still, roughly giving, 1/3 or so of younger people are getting vaccinations, and we know that's where the problem is. And we're going to have to do everything we can to keep trying to convince them to do that. As the mayor said, it's so easy to get the vaccine today. It's not any cost to it. Maybe some administrative cost in some of the drugstores, but University Health, Bexar County Hospital District, Brian Alsop's with us here, the director of it, and Teresa Ruiz is with us here today, who's a pediatrician. I think we administered well over 400,000, a huge percentage of the shots just at Wonderland alone. And now what we're doing, we have it at the Robert B. Greene Hospital right downtown, central location. You can go there and get it for free. We have 30 different clinics throughout the community. We're working with anybody that comes into our clinic and trying to encourage them to get a vaccine, and then arranging for them to be able to go to the Robert B. Greene. As you know, you have to go through a lot of precautions, from freezing to providing the vaccine in the right way, and so we wanted to be sure we're doing it right, and we're doing that at the Robert B. Greene. Let me just tell you what can happen to you. We already see the hospital numbers up. 95%, according to George Hernandez, who's president of University Hospital, are people in the hospital that have not been vaccinated. And it's happening every day. And what happens, not only may you end up in the hospital for not being vaccinated, and this applies to young people too. The average age of people in the hospital are coming down, and a lot more younger people are ended up in the hospital. Now, if you choose not to do that, if you choose not to get the vaccine, here's what's happening to a lot of people we call long haulers. People that may not end up passing away, or maybe they don't even end up having to go to the hospital, but they have long-term COVID effects that go from severe fatigue to cognitive issues, to memory issues, to digestive problems, and a host of other complications. So any young person today choosing not to get the shot puts themselves in great jeopardy. Not only are they putting themselves in great jeopardy, they're putting everybody else in great jeopardy. So it's the people that are in our community, that are moving around out there, that are giving each other COVID and leading some to devastating effects. So we plead with all of you to get your shots. It's free. There's multiple places to go. And you're putting our community in a jeopardy by not doing that. I wish you would show more respect to other people other than yourself. So we really encourage you to do that. Commissioner Clay Flores is here, and she just wanted to say a few words in Spanish and whatever.
So 2 of my volunteers have died because of COVID. And even when people are vaccinated, recently found out that one of my friends who's vaccinated, and her group of friends got COVID from one person in their group who was unvaccinated. So many people are thinking that COVID is over, and I've been to several events with lots of people in the room, and I'm the only one who's still choosing to wear my mask. So I just want to encourage people to continue to wear their masks. COVID is not over, it's not yet dead. Muchos están pensando que el COVID, que ya está terminado, que ya ha muerto, pero no es cierto. 2 de mis voluntarios han mordido de COVID. Entonces, estoy aquí para animar a la gente que siguen usando sus máscaras. Muchas personas que yo conozco que todavía dicen que están esperando para tomar su vacuna. La verdad, no sé a qué estás esperando. Pero los que dicen que están esperando, ya es tiempo para tomar su vacuna Estamos aquí para apoyar a la comunidad, que es necesario tomarlo, y también por cuidar a sus niños, porque todavía los niños solamente de 12 arriba pueden tomar su vacuna. Entonces, están poniendo en peligro nuestros niños menores de edad. Gracias.
All right, as you know, our community owes a debt of gratitude to our Metro Health team that's been leading us in science and medicine, many of them, and have joined us quite a bit, particularly Dr. Bridger, who is now taking another role at long last, but we do now have a new Metro Health director here at the City of San Antonio. I'd like to introduce you to him now, Claude Jacob, who's going to talk a little bit about our local vaccination efforts, pop-up clinics, et cetera.
Thank you, Mr. Mayor. Good afternoon, and thank you for joining us to provide some critical COVID-19 updates to our community. Let me start by introducing myself. Again, you've heard from the mayor. My name is Claude Jacob, and I am the director for the San Antonio Metropolitan Health District. I have quickly discovered San Antonio to be a warm and friendly city. It is an honor to lead the continuing public health response to the COVID-19 pandemic. I'd like to thank everyone who has done their part to contain the spread of this virus, from staying home when you can to wearing masks and getting vaccinated. Every step we have asked the public to take has made a big difference in keeping people safe and healthy. I want to assure you that the Metro Health team and the City of San Antonio remains vigilant in the fight against COVID-19. Metro Health constantly monitors patterns of transmission and deploys the necessary resources to mitigate the spread of the virus in our local community, like you've heard about our pop-up clinics and mobile clinics, our community ambassadors and outreach staff, our social media campaigns, to name a few. Part of this work has also included working tirelessly with our community partners, including the community health centers, our faith-based organizations, and businesses to make the COVID-19 vaccine accessible to as many people in the community as we can. The best thing you can do to protect yourself from COVID-19 is to get vaccinated. As you've heard from the mayor, I'm really proud to report that our overall vaccination rates are keeping pace with the national averages, which is a testament to the resolve of our fantastic staff and the support of our citywide partners, citywide and regional partners. That said, we do know that in Bexar County, that 1 in 10 individuals who have received their first vaccine dose have not returned for their second dose, which is a trend happening around the nation as reported by the Centers for Disease Control and Prevention. To be protected against the virus, you must be fully vaccinated. Being fully vaccinated means 2 weeks after you receive your second dose of either Pfizer or the second dose of Moderna vaccine, or 2 weeks after receiving the single dose of the Johnson & Johnson vaccine. Until you are fully vaccinated, please continue to wear a mask and maintain the appropriate social distance where feasible. As mentioned, we are doing everything to make the vaccine available to our residents and visitors. Metro Health has hosted approximately 300 vaccine clinics to date. We've also worked with area school districts to host 48 on-site clinics. I'd also like to address a few things we've been hearing about vaccine hesitancy. Studies have shown that the vaccines are safe and highly effective in protecting fully vaccinated people from contracting and spreading the virus. Also, it is not too late to get your second vaccine dose for those who have not already received their first dose. Bear in mind that for young, healthy people, the chance of being hospitalized if they acquire COVID-19 is at least 1 in 100, while the chance of severe adverse events from the vaccine is about 50 in a million. I know there has been talk in the media about concerns about the safety of the Johnson & Johnson vaccine. We understand that there is a rare autoimmune disorder which also happens with COVID, and it might happen more with the Johnson & Johnson vaccine. That is being studied. The risk is about 1 in 130,000. This does not appear to be the issue with the mRNA vaccines. Furthermore, the CDC, the Centers for Disease Control and Prevention, does not recommend mixing and matching any vaccines until we know more about what changes, how that changes effectiveness. Nor do we recommend booster doses at this time. Keep in mind that the CDC has reported that most individuals who are hospitalized have not been vaccinated, as you've heard. So again, we urge you to be fully vaccinated. Finally, we'd like to take a moment to remind all parents that if you have a child who is 12 years and older, now is the time to get them vaccinated. The new semester starts in a few weeks, so please don't hesitate. In fact, for anyone looking for a chance to get vaccinated, we invite you to come out this Saturday, July 17th, to Toyota Field, home of the San Antonio Football Club, where the City of San Antonio and Spurs Sports and Entertainment will host a vaccine event from 8 a.m. to 1 p.m. As a special incentive, the Spurs organization will give away a 10-game season package to one lucky person who gets vaccinated at this event. We really hope to see you there. In closing, I do want to take a moment to thank Mayor Nierenberg, Judge Wolf, City Manager Eric Walsh, and Assistant City Manager Dr. Colleen Bridger for helping to protect San Antonians during these unprecedented times. As a newcomer, I've been most impressed by the response efforts on the ground and the support of our city partners, especially given the complexities and the disruption caused by this global pandemic. We have a fantastic team on the ground. I truly believe that it takes a village to raise a healthy community. It's important to underscore our appreciation to the ongoing collaborations as we continue our fight against COVID-19 together. So remember, do it for you, do it for your family, do it for SA.
And to underscore that point of collaboration, but also in particular getting ready for school, I'd like to ask Dr. Alsip to come up from the University Health System. He is the Chief Medical Officer, has joined us quite a bit on these briefings. Doc?
Thank you, Mayor, and good afternoon, everyone. I think first I'd like to say that as a community, we should take great pride in the success that we've had in getting so many people vaccinated against COVID-19. You know, the decline in cases that we've seen, the reduced hospitalizations, and the lower positivity rates that we saw over the past few months really has enabled us to relax a lot of the restrictions that we've so long endured. However, as we've heard, there have been some recent reversals of those favorable trends. In addition to the positivity rates that the mayor shared, hospitalizations of our COVID-positive patients that the judge referenced have increased by over 57% in the last week alone. This pandemic is not over, and our work is not done. As we've seen in other parts of the country, the Delta variant has become the predominant strain of this coronavirus, and it is spreading rapidly and overwhelmingly among those who are unvaccinated. The connection is undeniable. Nationally, over 99% of all recent COVID-19 deaths occurred among people who were not immunized, and only 1% of all COVID hospitalizations occurred among people who were fully immunized. We are seeing those trends here locally as well. As Judge Wolf mentioned, at University Hospital, over 99% of all of our current COVID-positive patients have not been fully vaccinated against this disease. The message could not be clearer. COVID vaccines prevent hospitalization and death. Without being immunized, you are at risk. This risk extends to those who cannot be vaccinated, such as children under the age of 12, for whom the vaccine is not yet eligible, and also those with compromised immune systems who may not respond as well to the vaccine. Their defense against COVID depends on using masks, physical distancing, and being surrounded by people who are fully immunized. Remember, vaccines protect the recipient and also reduce the spread of disease. So help us avoid more unnecessary deaths. Take advantage of the gift that vaccination offers to protect yourself and to protect those that you care about most. Thank you.
Thanks, Doc. And finally, before we get into questions, let me ask Dr. Wu to come up. She is our Chief Medical Officer at Metro Health and will be sharing a little bit more, particularly for our Spanish-speaking audience.
Volver a la escuela en persona es importante para el bienestar de los niños y la vacuna puede evitar que sus niños se enfermen gravemente. Es importante que todos reciban la vacuna COVID-19 lo antes posible, ya que la vacuna es gratis, es segura, efectiva. No puede contraer el COVID-19 de la vacuna. La vacuna no afecta la fertilidad. Su información no se comparte con ICE ni ninguna oficina de inmigración. su hijo puede recibir la vacuna COVID-19 en la misma visita juntos con otras vacunas. Ahora no hay necesidad de esperar 14 días entre vacunas. Y actualmente la gran mayoría de personas, de las hospitalizaciones son de personas no vacunadas, incluso a los niños y los jóvenes. Por favor, vacúnese. Gracias.
Great. Thank you very much. Everyone up here is available for questions.
School starts up next week, obviously next month. A lot of children are not eligible to be vaccinated. Any plan to help the local school districts as they're expected to open up at full capacity?
Well, we are going to continue to operate with the health labs that are open with our pop-up clinics. We're going to be working with the school districts to make sure that they are aware of those and are reaching out to their local communities to encourage parents to get their children vaccinated, those who are eligible. Anybody else want to speak to that in terms of coordination with the local school districts?
Well, the only thing that you got to have the parental consent. School district can't say vaccinate this kid, so you got to have the parent involved.
The districts have been holding a lot of vaccine drives.
You want to come up? Don.
The districts have all been holding a lot of vaccine drives, so as soon as you're eligible, we hope we learn more in the fall. Those children who are eligible, we encourage to get vaccinated.
Are children going to be able to be masked? You know, is it just their choice, or need students go back to school?
So we recommend masking and distancing and all those. Distancing in schools, by the way, is now 3 feet, not 6 feet. But we do recommend that for anybody who's not vaccinated, and that includes children. Yeah.
The governor took away the mask mandate for schools.
So it'll be up to them whether.
You gotta have
It is up to them. We recommend it.
Dr. Bridger, with so few people being tested now, is the positivity rate as meaningful as it would be if more people were getting tested? And the second part, are you recommending that people who have been fully vaccinated that might be showing symptoms still get tested?
Second one's super easy, yes. Regardless of your vaccination status, if you have COVID-like symptoms, please go get tested. The first question is, you're right. It's not exactly comparing apples to apples right this minute to compare a positivity rate that had a total number of tests of 60,000 to a positivity rate that today has a total number of tests of under 10,000. So like we have through the entire pandemic, we look at a multitude of metrics in order to be able to say, here's where we are with the pandemic. Positivity rate is one that makes a lot of sense to a lot of people, and we had that goal of below 5%, so I get that. But now what we need for people to start thinking about is this combination of positivity rate, 7-day daily average, and then the hospitalization. All of those are trending up, but as the judge mentioned, it's nowhere near where we were 6 months ago.
Is there an update on the number of cases that are Delta variant? And is there an update on the cases where people vaccinated have contracted COVID?
So there is absolutely no reason to believe that San Antonio and Bexar County are any different when it comes to the Delta variant. So just like we're seeing across the United States, Delta variant is the predominant strain. That's happening here as well. And I'm sorry, I forgot your second question. Oh, we are not seeing a lot of, you hear about the 1 and the 2, but we are not seeing a lot of cases among people who are vaccinated. Again, what we've been saying consistently is vaccination significantly reduces your risk for hospitalization, severe illness, and death. Just like with the flu shot, you may continue to get the virus, but it will be a milder case than if you had not been vaccinated.
And then also, I know that on the West Coast, recommendations have gotten a little bit more clear, recommending people wear masks in small gathered rooms. I'm I'm interested, or could you give us some sense as to, I've talked to a few local medical experts who have been part of the task force and have been helping out, and they say that, in the fall, expect things to possibly get worse and possibly recommendations could get stricter. How close, now that we're starting to see an increase, how close are we to potentially, if we are, getting more stricter guidance where you may be masked indoors, things like that?
CDC.
Okay, so there's the political side to that question, and then there's the scientific side to that question. On the scientific side to that question, we are following the CDC's lead. And right now, the CDC is not recommending that fully vaccinated individuals wear masks indoors. We will continue to monitor what the CDC recommends, and if it makes sense for San Antonio, that's what we will do. It makes sense for San Antonio right now, so that's what we're doing. As the judge has reminded all of us, the governor took away our ability to have a mask mandate, and so on the political side, that's a state-level question rather than a local-level question. But as Dr. Wu mentioned, we will make recommendations when we think that the science indicates that that's necessary.
Mr. Mayor, I don't know if you can answer this, or there might be somebody better who might be able to answer this question. I want to ask about hospitalization rates. A lot of the measures that we did in San Antonio and nationwide, we did to make sure we had hospital beds available. Who can talk about hospitalization rates and more specifically, hospital bed space that's currently available in San Antonio?
So the hospitals are busy. One of the reasons we're busy is because we're seeing a lot of patients that didn't come see us for the past 12, 14, 16 months. All of the emergency departments in this community, and actually in many throughout the nation, are very busy because of that pent-up demand. Add on top of that, these increases in COVID cases, we're extra busy. So as it reflects to specifically COVID-positive inpatients, the rates that we're seeing are much lower than they were in the wintertime or even a year ago in the summer. But as a whole, we're pretty full in a lot of the facilities because of a lot of this delayed care. So that's why we're particularly concerned about this reversal and the increase in COVID cases, because we've adapted pretty well to the increases that we're seeing for folks that have just been ill for other reasons and are now seeking care. But this is a turn in the wrong direction, and so as we've been through for the past 14, 16 or months or more, we're working with all of our partners to make sure that we follow that very closely.
Doctor, I understand the hospital bed space is like 90% or above 90%. Is that correct?
That's correct. It's pretty tight, but as we said in other parts of the pandemic, we're pretty busy at different times of the year as well, and so that's not necessarily unusual. What's unusual is this excess of a pandemic disease that we didn't have 2, 3, or 4 years ago, and that's what's adding, I think, pressure to the hospitals.
Are we going to have to delay voluntary medical procedures again to make more bed space as COVID cases rise?
Right now, we're not at that stage, but like everything, we've got to follow it daily to sort of make those decisions, because you can't practically do that overnight. You really need to plan for that, particularly if they're elective procedures. You want to get information out to patients and communicate with them in an effective way.
So let me make a public service announcement. It's not entirely COVID related, but you're asking about elective surgery. We are still in a blood emergency as well, so just appeal to everyone who's listening, if you are able to host a mobile drive, if you're an employer or if you're an individual donor, please go give blood, because there's an incredible shortage of blood supplies, particularly that for used in trauma, but also those elective surgeries that might have to be deferred because of blood.
Dr. Jacobs, Mr. Jacobs, you mentioned that boosters are not needed right now. Is there any idea of or any word that they will be needed soon, and if so, will the city be the one giving that out?
Thank you for the question. Again, this is per the recommendations from the Centers for Disease Control and Prevention, so they're not recommending at this time. We're following at least the news and what's happening with that discussion down at the CDC, but between the CDC and the Food and Drug Administration, they are not recommending a booster shots or that third shot at this time. So we have heard some narrative about those who are immunocompromised. So again, we're following the narrative, we're balancing the art with the science of our work, so we'll keep the community informed as the situation continues to evolve.
If the time comes for a booster, would the city be giving that
Again, so heads are nodding that yes, the city would be giving that out. Mind you, this is day 7 for me, so just imagine. This is really an exercise to share with you all the blips on the screen as we're watching it. So again, we remain vigilant, we're monitoring the situation, and we'll pivot as needed.
A question for Dr. Lee.
Yes.
We're seeing children getting COVID right now. I paid a visit at several summer camps. Masks are not required. Should there be changes, and what recommendations would you give?
Oh, I have to back up everything that people have said here so far, which is that we're following the CDC guidelines, right? And in terms of protection, again, it is layers of protection, which the number 1 is vaccinate if you're eligible. Get vaccinated. Number 2, wear masks. Because that is going to add on a layer of protection if you don't have the first layer. Number 3, wash your hands. And number 4, maintain distance. And I know that's hard with kids, but the people around them should be vaccinated and should model wearing masks and washing hands.
Can you all trace back this increase to any particular event? We had Fiesta last month. We had 4th of July just less than 2 weeks ago. Is there any point where
I'm going to let you answer.
these increasing cases of positivity that can be traced back to?
I think it's a little bit of everything. I think the leading cause is the Delta variant, which is more contagious. And you add on top of that the fact that we have more people gathering together, which provides it a better avenue for spreading. So I think it's a little bit of what you're saying. It's not like last year where we could turn and say this is absolutely, cause and effect to the 4th of July. I think it's just a number of different factors.
There are other places that people can get the vaccine right now, but as far as testing, we've seen some of the things like the curative, and please correct me if I'm wrong, community labs closing some of their public testing sites. We've also seen people that are asymptomatic not getting tested as much anymore. So where are places that people can get tested rather than outside of their doctor's office? Like, where can people go to get a test if they have symptoms?
So there are over a dozen free testing sites throughout the city. You can go to the health department's website to find those exact addresses. It is true that the asymptomatic testing that that Community Labs was doing predominantly in the schools is not happening while the schools are on vacation or on break. But people who want to be tested still have a dozen options where they can go do that at no cost. And then again, just like with vaccinations, a number of the pharmacy chains are providing COVID testing at no cost. A number of urgent care centers are providing COVID testing. So this isn't like at the beginning of the pandemic where people couldn't get tested. There's testing widely available.
And a few minutes ago, Dr. Asif had said that 99% of the people that are at University Hospital were unvaccinated, those that tested positive for COVID. What does it look like in the hospital systems overall? Is it seeing the same rate that 99 or a high percentage of people that tested positive for COVID are unvaccinated?
Yes, we're seeing that nationally, we're seeing that at the state level, and we're seeing that here in Bexar County as well. The vast majority of people who are hospitalized due to COVID, it's because they're not vaccinated.
Okay, I was going to direct this to Mr. Jacob, but whoever can answer this. You mentioned focusing on young people who are choosing not to be vaccinated. Where else are you sort of targeting? What groups are you targeting? And then secondly, what parts of the community are you targeting to get those vaccines out there? You talked about the vaccine clinics, but are you changing anything? Are you going to a certain part of town that there are more vulnerable people? I noticed y'all have always been doing the Spanish thing, but are you trying to go into these primarily Spanish-speaking communities, that kind of thing?
Yeah, go ahead.
Good question. I would just say that we've been working with our partners on the ground. So whether it's designated neighborhoods across the city, we've talked about the event that's happening this coming Saturday over at Toyota Field. That's a promotional tool so that we can at least promote folks getting vaccinated. So we're looking at different tools. We have heat maps that look at different parts of the city. I'm looking at our team at the back of the room just so we figure out the best way to mobilize and deploy our assets. So the mobile clinics, the pop-up clinics, We have a whole schedule on our website where we can tell folks exactly where we're going to be next. So I would just say right now we're looking at an array of different tools. We're talking to partners on the ground. We're having conversations with providers. We're looking at this window for the back-to-school season, so we're encouraging parents to make sure that their kids are fully vaccinated. So it's not just one group, but you've already heard from the judge, for example, that folks under the age of 20 or 30, that younger folks, for whatever reasons, are not as, their vaccination rates are not as high as older adults. And so right now, we're looking at an array of different tools. We're looking at the maps across the city, and we're making sure that we're deploying the pop-up tents and pop-up clinics as needed.
Why don't we take one more, and then all of us are available for one-on-ones as necessary as well, so.
Doctor, to follow up on that question?
Go ahead.
And to that point, and I would love to hear from multiple people if possible. I'm a young person. I've been vaccinated. I have no friends, and I have friends who have not. I'm not sure how many percent of these people, but I'm sure there are a lot of people who know people who have yet to be vaccinated. How do you suggest people who have been vaccinated, family members, friends, how do you go about having that conversation? How do you recommend having that conversation with people who have not to try and maybe encourage them to think again about getting it?
Good question, and I'll just tell you my story. So again, I may not be as young as Hugh, but I consider myself to be young at heart. Really, at the end of the day, I didn't want any of my family members, friends, or loved ones to contract the virus because of me. And so it's a conversation that you can have with your friends and loved ones, and it's a personal decision that people can make. And so I would just say that that's what we're encouraging folks to do it for SA. There's a reason we have that tagline. So it's an individual conversation, it's a personal decision, but for me, I just didn't want anyone in my orbit to get sick because of me. And so that's why we're asking folks to be more altruistic about this and just think about making sure that they don't spread this virus to one another.
Let me add one piece of advice to that. Tell them to get off of social media. We tracked from last year, there were 147 sites putting out false information about the effect of vaccinations. 51 million people listen to those 147 sites. A lot of young people today, isn't that they don't know how to read, they don't read in most cases, and they all go to social media. That is the most dangerous thing that's happening in terms of trying to convince people not to get a vaccine, and too many of you people are doing that. So if you got a parent of a 20-year-old or 19-year-old or a 25-year-old or 35 years, tell them to listen to professionals.
I just have to jump in and also say it also has to do with tone and just keeping a conversation open. And not having it come from the point of view of just, how come you haven't been vaccinated, right? By the way, the CDC has a site with some tips, but it starts with listening. People have real concerns, people have legitimate concerns, and it's just a matter of listening to what those are, and then asking if people are interested in being pointed to some alternative information. An ongoing dialogue. Thanks.
Michael, and then we'll wrap up.
And I wanted to follow up on a question that she asked earlier about strategies going forward. And I know the president, and if I could ask you, I know you're right on the starting your job, but maybe I could ask you already. The president has already talked about and floated the idea of going door to door, walking neighborhoods, just going house to house. Is that something that you're interested in?
So thank you. And again, this is the Neighborhood Ambassadors Program. So I would say that, again, hailing from a different state, I'm familiar with that model. We deployed that, again, in Massachusetts. And we have a number of partners on the ground who are already helping us message that. So empowering the ambassadors, it's really amplifying the power of the trusted source. So we are talking about how we can do a better job messaging that, packaging that, whether it's faith-based organizations, businesses, local community partners. So anything and everything in any way that we can get the message out, recognizing culture, language, and hue, we're just making sure that we deploy that. So the neighborhood ambassador model, that is popular, and we're already doing that here in San Antonio.
All right. Thanks, everybody.
Thank you.
Thanks, Tom.
Yes, ma'am.
Thanks for doing this.
Same here. Yeah, well, you know, it's good. I'm like, hey, man, this is like, Agility has been scheduled in the chat, so thank you for this.
Oh, okay. I just want to ask how he feels about starting his job in such a chaotic time.
We're going to do that.
Okay. We'll wait next week then.